Hi, my name's Monica. I'll be your nurse today.
Okay.
What I'll be doing today is performing an eye and ear exam on you. There's several steps to this, so it might take us just a few minutes to get through the process, okay? The first thing I want to ask is, have you had any changes in your eyes or in your vision recently?
I just kind of have trouble seeing things that are really far away, but I'm going to go to the eye doctor this week.
Okay.
I've never had glasses or anything like that.
Okay. Is there any concerns other than that?
No.
Do you have a family history of glaucoma or cataracts, anything like that?
No.
Okay. When was your last eye exam?
A few years ago.
Any idea of about how many years ago?
Probably like 3 years ago.
And there was nothing wrong at the time? There was no changes or nothing
No.
that required corrective lenses at the time? Okay. The first test that I want to do is I want to test your vision. So I'm going to ask you to step up, and we're going to be about 20 feet away from this chart. And I want you to cover I want you to look straight ahead with both eyes actually. Okay? And we're going to start at the top, and I need you to read these out loud for me, okay?
Okay. E, F, P, T, O, Z, L, P, E, D, F, P, E, C, F, D.
Good.
E, O, F, C, Z, F.
Okay. Can you read anything below that line?
No. I can barely read that line, actually.
Okay. Now, can I ask you to cover your right eye? And read these for me, please.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, O, Z, F.
Okay. Now, can I get you to cover your left eye?
Okay.
All right.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, O, P, C, Z, E.
Okay. Right. Go ahead and have a seat there for me. Try to locate my new vision chart. Let me make a couple notes here. Okay. Now I have another thing that I need you to look at for me. And I need you to kind of hold this about at that level and read the smallest line that you can read for me.
I'm gonna read that. I can
Okay, read the numbers, that's fine.
3, 7, 4, 2, 5, 8.
Okay.
Okay.
Let's try do an individual eyes with that one as well.
Okay.
Can you cover your, there you go,
Okay.
which is the smallest one that you can read.
I think it'd be that same line. It's 3, 7, 4, 2, 5, 8.
Okay, and cover your left eye.
3, 7, 4, 2, 5, 8.
Okay. Okay, let's get that out of our way. I'm just gonna clean my hands. I'm going to test for is I'm going to check your eyes to make sure that your eyes are aligned well. We're going to cover one eye, and I'm going to have you look at a focal point on me, like my nose. And then when you move that hand away, I'm going to see if your eye drifts away or if it stays in place, okay?
Okay.
And then we're testing for confrontation, okay? So cover your left eye. It's okay, I have to think about that too. Look straight at my nose. Okay, now move that hand away. Okay. Cover your right eye. Same thing, look straight at my nose. Now move that hand away. Okay. That's perfect. Where I put my pen here. Now I'm going to assess your eyebrows and just the anatomy of your eyes, okay? Looks like your eyebrows are symmetrical. Do you have any pain or tenderness as I palpate or feel along this area? Okay. Note that the sclera of your eyes are white, that the iris is a hazel green color. Your pupils appear to be about 3, let me see here. They're about 3 millimeters, equal, round, and reactive to light. Just check again there. Your conjunctiva are pink and moist. Upper eyelids are symmetrical, and lower are symmetrical as well. There seems to be no abnormalities there. Didn't feel any kind of problems with glands. There's no tenderness in this area. We'll just assess that again, okay? Didn't feel any lumps or anything along that area. Now we're going to do a test called the swinging flashlight test, okay? So all I need you to do is to look straight ahead at me, look at my nose, and I'm just going to rotate this light from side to side. Don't follow the light, just look straight ahead, okay? Okay. The next thing we're going to check is for peripheral vision, okay? So we're going to cover each eye, okay? So I want you to go ahead and cover your right eye first. All right, I want you to look straight ahead at my nose. And I want you to follow my fingers. Perfect. Cover the other eye, please. Okay, and you can look straight at my nose here and follow my fingers. Okay, perfect. The next thing I'm going to assess is the corneal light reflex. Dim the lights. This. Okay, need you to fixate on an object about 15 feet from me. Okay, in this direction. Just fixate on an object. That's perfect. All right. Now I'm going to move on to your ears. Okay. So I'm going to, has there been any problems with your ears, any drainage from your ears, recent ear infections, any hearing loss, anything like that? Okay, I'm going to assess for symmetry of your ears and just look at the external part of your ear to start out, okay?
Okay.
So you've had your ears pierced for a while?
Mm-hmm.
Okay. Now I'm going to take a peek in your ear canal. I'm not going to go all the way in, well, I'll go ahead and go all the way in. And then this is an adult patient, so I'm going to pull the peanut up and back. See, your eardrum is pearly gray. There is a little bit of redness back there. and a little bit of wax noted in the ear. So we'll check the other ear. Again, I'm going to pull up and back because this is an adult patient. Is that a little tender?
No, I'm okay.
Okay. This one is more pearly gray. This one appears more normal. There's a little bit of wax noted in this ear as well, but no redness or no fluid. Now we're going to check for volume, like to see if you can hear really well. So we need to plug your left ear. And I'm going to whisper some numbers in your right ear, and I just want you to repeat the numbers, okay?
9, 9, 17, and 2.
Correct. Okay.
72, 34, 63.
Good. Okay, and the last thing that I want to test is, it's called a Weber and Ron test.
Uh-huh.
And the first thing that I want to do is you're gonna hear a noise with this, okay? It may feel a little funny as it's touching you, but what I'm looking for is to see what ear you hear best out of, okay?
Okay.
So we'll start with the Weber test. Checking my own reflexes here. All right. Can you hear that?
Yes.
Can you hear it in both ears?
Yes.
Okay. Perfect. All right. The next thing we're going to do is the Ryan test. Okay. So what I'm going to do is I'm going to place this on your mastoid bone,
Okay.
the base of it here, and then what I need to know is if you hear it, if you're hearing the noise more here, or when I turn the tuning fork around to your ear.
Okay.
Okay? So we'll start with your left ear. 1 or 2?
I hear it in both.
Which did you hear it better in?
Up front.
Okay. All right. Just let me know which one you hear it best in, okay? We're going to do this ear.
I hear it. Mm-hmm.
Better first or second?
The second.
Okay. I think that wraps up this exam.
Okay.
We will
Thank
need you to get you in to see an eye doctor, and you said you were already planning on getting you an appointment for
Yes.
that.
Mhm.
And you probably need to get in to see a physician as well for that left ear. If it may start bothering you a little bit because you do have some redness in there and some
Okay.
irritation. Aside from that, no Q-tips to clean the ears with. That'll only pack the wax in the ears, okay? And I think that's it.
Okay.
was a
Thank
pleasure
you so
meeting
much.
you.
Nice meeting you too.
Thank you.